I'm here today to talk to you about my program of research. So, as was just said, I'm a PhD student and I still have a long career of research ahead of me. However, I have a clear vision of what research I'm interested in pursuing, and that is facilitating person-centered mental health nursing care through a nursing research practice partnership. So there's no video, but there you can see me. As I said, I'm a novice researcher. I've done all my education at Memorial University, which includes a Bachelor of Science and a Bachelor of Nursing, followed by a Master's in Nursing, and now my PhD. Upon graduating from my undergraduate nursing degree, I started working at the Waterford Hospital, practicing mental health nursing. I've remained working as a casual employee for Eastern Health in the program for more than 8 years, while currently furthering my education. About 4 years ago, I started teaching nursing on a contractual basis, and my hope is to be hired by the Faculty of Nursing as a tenure-track professor upon graduation from my PhD so that I may further my academic career in teaching and research. In order to clearly explain how I plan to facilitate person-centered mental health nursing care through a nursing research practice partnership, there's a few definitions that we need to clarify. So the first is, what is person-centered care? McCormick and McCants are two researchers in Europe who've extensively studied person-centered care. They most recently described it as an approach to practice established through the formation and fostering of therapeutic relationships between all care providers, service users, and others significant to them in their lives. It is underpinned by values of respect for persons, individual right to self-determination, mutual respect, and understanding. It is enabled by cultures of empowerment that foster continuous approaches to practice development. The person-centered care has been endorsed by many healthcare organizations in Canada, including the Canadian Nursing Association. In essence, person-centered care pivots on the humanizing of healthcare delivery, prioritizing the needs and preferences of individual patients and families rather than either the needs of healthcare professionals, the tasks of care, or the disease. The principles of social inclusion and social justice underpinning person-centered care align particularly well with mental health nursing, as our clients are more likely to face stigma, marginalization, social disconnection, and disempowerment. So I provided the schematic that McCormick and McCants actually provided the schematic, but it helps understand person-centered care and the process of person-centered care a little better. So let's look at this for a moment now. So basically, it indicates that there, on the exterior two circles, that there are prerequisites for person-centered care to happen. And that is that nurses must possess key attributes in order to deliver person-centered care, and that the care environment must be conducive to person-centered care ways of working. So a person-centered nurse is one who can manage the challenges of a constantly evolving care environment. They must possess a combination of the following: professional competence, interpersonal skills, job commitment, clear beliefs and values, and self-awareness. Impactful characteristics of the care environment include appropriate skill mix, systems that facilitate shared decision-making, the sharing of power, effective staff relationships, organizational systems that are supportive, potential for innovation and risk-taking, and the appropriate physical environment. So once all these prerequisites are in place, then we can move forward to the inner circle of the schematic. And this is component of the framework specifically focuses on the patient in their context. So person-centered processes focus on delivering care through a range of activities that operationalize person-centered care. These include working with patients' values and beliefs, engaging authentically, being sympathetically present, sharing decision-making, and providing holistic care. And then finally, person-centered care outcomes at the center of the framework demonstrate the results expected from person-centered care. So good care experience, involvement in care, feelings of well-being from the client, and the existence of a therapeutic culture. So most healthcare authorities in Canada will say that they have adopted a practice model that places the patient at the center of care. However, it's not that simple. Developing person-centered nursing care is not an isolated event. It requires sustained commitment from both organizations and individuals such as nurses. And despite strong evidence of the benefits of person-centered care, implementation has been challenging. McCormick and McCants in their literature has pointed out that nurses often create what they call person-centered moments. However, in most cases, true person-centered cultures of practice are yet to be achieved. Because person-centeredness is a fragile concept, it's reliant on a person-centered culture that emphasizes all the things in the outer two circles of the schematic. So my program of research will focus on those two outer circles, namely the most outer circle, the prerequisites of nurses. And so that's how, so how am I going to do that then? How am I going to focus on those prerequisites? Well, that's where practice development comes in. And so now I'll give you the definition for practice development. A continuous process of developing person-centered cultures enabled by facilitators who authentically engage with individuals and teams to blend personal qualities and creative imagination with practice skills and practice wisdom. The learning that occurs brings about transformations of individual and team practices. So essentially, practice development initiatives provide nurses with opportunities to expand their knowledge, promote and facilitate change, improve communication, respond to external influences, implement research into practice, and develop leadership skills, all through a person-centered lens. How does a nursing research practice partnership fit into all this? Basically, a practice partnership is, an academic practice partnership is a partnership between an educational institution and a clinical practice setting for common advances, such as advances in practice, education, or research. So basically, there's a nursing research practice partnership being formed between Memorial University's Faculty of Nursing and Eastern Health Mental Health and Addictions Program. It's a formal partnership. Its primary objective is to establish a program of practice-based nursing research involving mental health nurses that's successful in addressing important clinical problems. So it's a lot to get your mind around. So there's this visual aid that may simplify things a little bit or clarify things a little bit as to how all this is related. So you can see that the partnership is in the exterior square there. It provides a vehicle to access mental health nurses and clients so that they can participate in research initiatives that can address things such as implementing practice in the research, improving staff, nursing clinical leadership, improving client-nurse relationships, and strengthening nursing knowledge. Not only can they participate in the initiatives, but will also be invited to help conceptualize the initiatives and identify what are the most important in their practice setting. So by implementing practice development initiatives, I'm striving to help mental health nurses in advancing their own practice. Practice development initiatives will address those prerequisites in that outermost circle of the former diagram. And these changes have the potential then to transform cultures in the context of care, which is in that inner block there, in the mental health and addictions program, so that we may create more and more person-centered moments and perhaps with time achieve a true person-centered culture. So that's the kind of, let's say, theory behind it all, or the thought behind it all. So now let's talk about what has happened in reality. This is a kind of a timeline as to how what has happened thus far in my program of research. So myself and my supervisor have been talking about taking steps to build this practice partnership since 2018. It all started when I was a master's student. I wanted to see if a partnership was feasible. I started out with consultation sessions with nurses and leadership with each organization. I then led a feasibility study to demonstrate the need for the partnership. And then for the past year or so, myself and my supervisor had a meeting with senior management from the Mental Health Care and Addictions Program to begin establishing the partnership. This past 6 months, I've begun some initial work with nurses in the program by starting a journal club. And my PhD study, which I'm currently writing a proposal for, is also related to this program of research. So now I'll get into a little more detail about each of these. So first, the consultation sessions. In the winter of 2018, I met with leaders from both organizations to see if they saw value in the partnership, which they did. I also met with 19 direct care nurses working in inpatient units at the Waterford Hospital. We discussed their interest in research, their work life, and priority person-centered care issues. For example, a number of nurses addressed the lack of activities offered to patients as a priority issue on their units. They described few patient resources and little in the way of recreational activities for individuals who are confined to the unit. Nurses also spoke of the importance of treating patients in a humanistic way, filled with respect and compassion. They noted that a good rapport with patients was essential for individuals to maintain a sense of self, of being human. Nurses identified that many patients with an enduring mental illness did not have strong family connections, and they pointed out ways that they did things on a regular basis to create a family-type atmosphere. And finally, they identified the need for a higher level of patient-centered care. Nurses felt that patients lacked a voice and the ability to be heard on a busy, often hectic acute care unit. They noted that in the past, there was a past practice of daily unit meetings with all patients and nursing staff, and they thought that was an effective way to improve unit communication and create a forum for patients to identify and address day-to-day issues on the unit. In the past, these meetings had occurred regularly and were led by nurses. They brought patients and staff together to inform patients about unit activities. They got to know one another and discuss any patient or staff concerns. Nurses in the consultation session saw those meetings from the past, those who could remember them, as valuable. So, based on the consultation sessions with psychiatric mental health nurses, and particularly the interest of a small group of clinical nurses willing to participate on a research team, a group was formed to develop a research project, the feasibility study. Four research team meetings led by myself resulted in the development of a research proposal. The team identified the research topic and guided the project throughout the course of its development. The title, Exploring the Benefits of Nurse-Led Community Meetings on an Acute Psychiatric Unit. So we used a mixed methods design to determine if community meetings would result in things like an improved overall experience of care for patients, change in the therapeutic milieu of an inpatient psychiatric unit, improved working environment for nurses. We also evaluated nurses' perceptions of the program or community meetings, as well as their interests and attitudes toward research. Registered nurses on East and West 3A at the Waterford Hospital were recruited to participate in the study and complete baseline questionnaires. Education sessions were provided to nurses on both units to inform them of the study and their role and the role of their unit. Nurses on West 3A, of course, received additional training as in terms of facilitating the community meetings, as the meetings will be implemented on that unit, and East 3A will continue their usual care as a comparison unit. Community meetings started on West 3A February 4th of 2019 and were held on average about 3 times a week for 6 months. A research nurse facilitator provided support and coaching to the nurses throughout the study. Patients on both units were invited to complete a questionnaire at discharge during the intervention period. And after 6 months, a second round of surveys were collected from nurses on both units, as well as individual interviews were conducted with nurses on the intervention unit, West 3A. Finally, co-white data was collected from both units over the course of the study, and also nurses filled out unit milieu forms to assess the milieu of their unit every shift. What we know now is that now that the study is over and we're analyzing the data, that the study likely will not produce statistically significant results. Like I said, now it's still being analyzed, but that's what we kind of anticipate. What the study has taught us so far is that patients were very engaged in the community meetings and they felt heard. Nurses seen them as valuable, but there was resistance from nurses to facilitate the meetings. This type of outcome is common for practice development studies, and it speaks to the need for additional work developing local mental health nursing practice and transforming the culture and context of local mental health nursing care. So, as time went on, as I said, we continued to meet with leaders of the organizations, namely myself and my supervisor meeting with officials from Eastern Health, or senior management from Eastern Health, in establishing the partnership. That's been going on now for a few years. We've developed the draft terms of reference and are currently exploring options as to the most appropriate way to formalize the partnership. Nurses and we have agreed on formalization, but we're kind of working out how to best, operationalize that. Nurses and patients will be central in guiding the work of the partnership going forward. So next I'll just talk a little bit about the Journal Club. So one initiative that started within the partnership already, not so much a research project, but just an initiative, is a monthly journal club which I facilitate, where we discuss one mental health nursing research article related to mental health nursing per month. There's approximately 30 members, and we welcome all RNs and LPNs to the club that work in either community or inpatient setting in the mental health and addictions program in Eastern Health. The first meeting was in November 2020, and topics that we've covered to date have been caring for patients who hear voices, alternative ways of caring for those who self-harm, violence in mental health nursing, trauma-informed mental health nursing care, bedside handover, and then the meetings that we have tonight the topic of discussion will be questioning the alignment of community treatment orders and mental health care programs that endorse a recovery-oriented approach. Through participation in the Journal Club, nurses are learning how to read and understand research better, become more familiar with critical appraisal, learn alternative practice strategies and practice advantages, and apply research to personal practice. So now to talk about my PhD study. I want to tell you about that a little bit, of course, because that's where I'm headed, I guess, the next steps for me in research. The state of person-centered mental health nursing care in Canada is not well established. Further, there is no existence of literature on the extent to which nurses and mental health clients are engaging in person-centered care in the province of Newfoundland and Labrador. Therefore, the purpose of my PhD research is to examine person-centered mental health nursing care from the perspectives of clients and nurses in the province of Newfoundland and Labrador. Secondarily, another purpose is to provide baseline data for the nursing research practice partnership by doing a sub-analysis on the data from the Eastern Health region. So the study will be a mixed method study. I'll invite mental health nurses across the province to complete a questionnaire, and I will invite those receiving services in mental health to be interviewed. I'll be including both community and inpatient nurses and clients across the province. So in addition to that, I plan to collect observational data on 4 inpatient units in the Eastern Health region as to collect objective data on person-centered care being received by clients. Given what I've read about studies such as this and person-centered care in nursing and mental health nursing, I hypothesize that nurses will score high on the questionnaire, the person-centered practice questionnaire, and that's for 2 reasons. We as nurses tend to self-rate as high on questionnaires, and people in general, not just nurses. And also because I do think that nurses want to provide person-centered care. Contrastly, I think that the observational data will provide a disconnect in that care interactions will likely not indicate person-centered care is occurring as often as nurses report it. Finally, I think that patients will indicate a level of person-centered care that's somewhere in between what's reported by the questionnaires and then by the observations. I think that all of these findings will support the notion that person-centered moments between nurses and patients in psychiatry do, of course, exist, but they need to exist more consistently. I think it will support the notion that we need to strive for person-centered cultures and that we certainly aren't there yet. So some other work that I have been doing throughout my PhD kind of, support my program of research and the work around that is I've been working on a scoping review, and it's I'm not sure if anyone's familiar with the Joanna Briggs Institute or JBI, but it's a scoping review that I'm doing through that organization, through that publication. And so we have and it's on staff nurse clinical leadership. Now, this isn't specific to mental health nursing, but it's certainly obviously applicable, as clinical leadership among frontline nurses is important for person-centered care. So that's being conducted with myself and my supervisor, Dr. Joy Madigan, as well as a couple other professors at the university in the nursing faculty, Dr. Small and Dr. Jarvis, as well as a librarian at the Health Science Center, Michelle Swab. So we've been working on that, and we've recently been accepted to publish the protocol for the scoping review, and we plan to conduct the actual review itself over the coming months. In addition to that, myself and my supervisor have been working on an integrative literature review on practice development in mental health care settings. And of course, that would be obvious as to why we would do that, because my program of research will involve a lot of practice development initiatives in mental health. So finding out what has worked well in the past, what exists, those kinds of things will be beneficial to my program of research going forward. So we've been working on that over the past 6 months or 8 months or so as well. And so that's another thing that's kind of linked in there. So I'm just going to draw back now to that slide I had up there before, now that we've talked about all the initiatives, so that we can, just link it all together. So as I said, on the exterior block there is the research practice partnership, and that's providing us a vehicle to enter into the healthcare authority and to engage with clients and nurses in order to identify practice care issues that are important, and to have nurses and patients or clients work with us on developing research studies that will ultimately better nursing practice. And then when you move in through the next circle there, so strengthening nursing knowledge, that's being done through having nurses engaged in developing research studies, as well as nurses who are now involved in the journal club are strengthening their knowledge of nursing. Nurse-client relationships are community meetings. One of the hopes from that study was to improve nurse-client relationships by having nurses facilitate the journal clubs and get to know patients on the unit better, and for the patients to know them better, and create a level of communication where patients felt they had a voice. Clinical leadership at the point of care. So as I said, I'm working on a scoping review about staff nurse clinical leadership. And although it's not an interventional study yet, of course, scoping reviews, integrative reviews, and things like that set groundwork for future interventional studies. So obviously that's going to be an area of focus in years to come for me as well. And then research to practice. Of course, as I mentioned, the Journal Club is addressing that, and as well as simply having research studies in psychiatry is another way to integrate research, to have research come to practice. For example, the nurses that were involved, our 4 nurses that were involved in having our community meeting study, they were involved in developing the protocol for that study right from beginning to end, right from determining the question we had, the methods, implementation, even dissemination. Our nurses have been involved with doing presentations on disseminating the results we've had to date, and I'm sure they will be involved in, when we're completely done the study, in disseminating further. In addition, then, of course, as I said, we did have a facilitator who was a nurse, a registered nurse in psychiatry, Bob Kavanaugh, who facilitated those meetings. So that individual wasn't just on our practice, involved in developing the study, but also, seeing it through right on the ground with nurses. So those 4 nurses were very involved in research in a way that they would not have otherwise been had we not done that project. And that's just one project. I have a whole career ahead of myself to involve nurses in mental health in research. And then, of course, the nurses that were on the unit and were involved in taking questionnaires and involved in actually facilitating the community meetings. Of course, that brought research for them to the forefront, where they may not have had that experience to be involved in a study like that before. To my knowledge, there is relatively little to no mental health nursing research going on, especially not in regards to nursing research in the care areas specifically. In terms of interventional studies. And so it's at least not in my career time so far, and that's something that I am hoping to change and hoping to build with other colleagues at the university, as well as with the frontline nurses. I am very interested in working on practice problems that are relevant and important to those that that is most important to, which are nurses and clients and families of clients.